What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building with the Be More Today show. We are back. We are back. We are back in the building. And folks, episode 133 is about to be in the books. We're here for National PT Appreciation Month, and it's a great month focusing on all the great things that we as PTs do. And as you know, Be More Today does a lot of those things. We support all things that are based on health and wellness and fitness. And the Be More Today shows has been here for now going on 4 years. BeMoreToday.com has everything you need for my book, our swag store, the show, which continues to grow, now heard in 80 countries, over 52,000 downloads. Again, thanks to your love and support that you have been here taking your steps to greatness to be the best version of you. So continue to follow us on social media platforms, Be More Today, YouTube, Instagram, leads, threads, all these different things. We're everywhere now. And it continues to be great to see people taking their steps to be the best person of themselves and not giving up on their goals in any capacity. My quote for today is simple as always. When you've exhausted all possibilities, remember this: you haven't, by Thomas Edison. This has been a year, folks, that is slowly winding down. And one of the great things about being a physical therapist, I believe, is that people come to see us every single day with dreams. They're trying to get back to the life that they love. They're trying to get back to doing what they used to do, want to do. And sometimes it feels like they're at the end of the road. They've seen MDs, they've seen all kinds of people, and they've been given to us to hopefully get them back to where they want to be. And for some people, they feel discouraged. They feel like there's no more hope because they've done so many things and they've gone on YouTube and gone on other things and they've tried to figure out how to fix themselves, but haven't got a chance to do that. And we as PTs, I think, in my 12 years of practicing, we help people to get back to the life that they want to get back to go back to doing anything that they want to do, and to give back hope where it feels like hope is lost. And one of those things that I think is a taboo subject, and a subject that is always now in the mainstream and a part of culture for both men and women, is talking about pelvic health. And I want to talk about pelvic health today because it's one of the things that a number of people struggle with, but don't really know where to go to for advice or for assistance. You see a lot of commercials on TV and a lot of things that are showing you what you can and cannot do, but sometimes it seems like it's hopeless. And my guest on today's show is going to help us to realize that there is hope, that even when you've exhausted all possibilities, that you really haven't if you come to see her or other PTs who are specialists in this field. And her name is Michelle Dela Rosa. Now, she is the clinical director of the Hamilton and Howell locations at Jag Physical Therapy. She's been practicing PT in the field of pelvic health for 20 years. She started in Brooklyn, New York, and developed the Pelvic PT program in now NYU Langone Health. She implemented a weekly prenatal exercise class for the community and extended the program to treat pelvic pain in men and post-prostatectomy issues. She's had the privilege of consulting at hospital, urogynecology, urodynamics, and orthopedic clinics. Later, she continued to practice in New Jersey, where she helped to establish the pelvic health PT program at now Penn Medicine Princeton Health. Michelle graduated with a master's in physical therapy from Boston University in 2000. While at BU, she competed at the collegiate level as a member of the university's track and field team. And in 2005, she obtained her doctorate in physical therapy from the State University of New York at Stony Brook. As a native of West Windsor, New Jersey, Michelle opened her own practice, Connect Physical Therapy in Hamilton, in 2009, which had grown to become the leader of pelvic physical therapy in the state. She opened a second location in Howell, New Jersey in 2015, and their YouTube channel showcasing pelvic health education quickly grew to almost 100,000 subscribers. Michelle lectures on women's health and men's health issues at many community events throughout New Jersey, and she also enjoys being a teaching assistant for the Herman and Wallace Pelvic Rehabilitation Institute and earned the Pelvic Rehabilitation Practitioner Certification, which identifies her as a specialist in women's and men's pelvic health fields. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage my guest, my second guest for PT Appreciation Month, my new friend, and someone who I may have run track and field against, but probably did not. Michelle Dela Rosa. Michelle, what is going on?
Thank you, Sean. I have to say your smile is infectious. Like you're talking and I'm like, you know what? I'm going to smile today.
I did win
So
best smile
thank
in
you
high
for
school.
having me. I really,
Oh,
really appreciate it. Really
I'll
appreciate it.
take that. No problem. I appreciate you being here. And listen, your resume is super impressive. And talking to you offline, I did realize that we did just miss each other crossing paths, running in the New England area. You at BU and me at Brown University. So we're
Yeah.
running at the old BU track. That
Yeah.
band,
Just by a year. Just by
yeah,
a year, we missed each other.
just right here.
Yeah.
What was your event when you were at BU? What'd you do?
Half mile, but of course they tried to make me miler,
Oh yeah.
so that mid distance,
Yeah, I definitely would
right.
have seen you because I ran the quarter and I did jumping events, but I would have seen you on the track for
Well,
sure.
I did run the 4x4 at
Yeah,
times.
I would
So
definitely would
so
have
there
seen
you go.
you. Yeah, I
There you
definitely would have seen you. I definitely would have seen you. But I appreciate you making the time. And as this is our month talking about all things PT, I want to have you on the show because you are a certified pelvic rehabilitation practitioner. And that's something that a lot of people are leaning towards now when it comes to pelvic health and pelvic pain. And as someone who is a specialist in this field, I want you to be able to share with some of the listeners what some of the top reasons why someone may experience pelvic pain. It may be because a lot of people talk about it. Some don't even know that it is pelvic pain, but it might be back pain that's happening. And a lot of people don't know really who to go to or where to go. And a lot of things that you see online and on YouTube and wherever else say a lot of different things. But I think, and you know, because you're the specialist, there are certain things that we can do to give hope to this issue. So, what are some of the reasons why someone may experience pelvic pain in the first place?
Yeah. So as a physical therapist, we're still, even though we specialize in pelvic health, we're still dealing with the musculoskeletal system, right? We're not delving into two different realms. It's just a different part of the body, but still the musculoskeletal system. So, and by no means am I saying that all pelvic pain is musculoskeletal, because we know it's not. We know it's not. But our job as PTs is to sort of tease that out and say, I think the driver to your problem is musculoskeletal. Or someone will come in and I'll say to them, I think 50% of this is musculoskeletal, and 50% of this, I'm going to work with your physician. So I can speak on the musculoskeletal piece of it. We don't realize that some of the same reasons that cause shoulder, neck, and back pain are some of the similar reasons that cause pelvic pain, like altered posturing or repetitive activity, like, for instance, too much sitting. Sitting pain is one of the things that we treat. A lot of compensatory stuff, meaning like if I just had a baby and my abs aren't strong enough, then my pelvic muscles will probably try to help me, kick in. So that's an example of compensatory, altered voiding habits. So when I say voiding, I mean there's your bladder there's your bowel there, inside the bowl of your pelvis. So sometimes, let's say we treat some people who we love, our teachers, and sometimes they don't want to share the bathroom with the children, right? Let's be real here.
Yeah.
So what's happening, similar to kids, we'll do this at school too, they'll hold for long periods of time, right? So not just teachers, but I mean, there's lots of different professions and lots of different people who this will happen. This is one example. So I'm holding now and I'm clenching, all day, trauma, any kind of trauma, surgical trauma, childhood trauma, any kind of stressful trauma. I mean, we're going to have holding patterns in there. And then there's the category of medical conditions, all these medical conditions, whether it's infection or inflammatory or it's a dermatological sensitivity. But what's going to happen? They could have an associated musculoskeletal tension with that, where even if you've treated the infection, the musculoskeletal piece didn't just go away.
Right.
So now I'm still taking more antibiotics and I don't have an infection anymore.
Right.
I actually have muscle tension.
Yeah.
Right. I mean, this could be a lecture on its own, but the list is long, and to know, for people to know that there are a lot of overlapping reasons with just your traditional, the everyday joints that you would go to PT for.
Right.
So it's not such a far removed reasons, for pelvic pain. But most of the time, I'm going to say there's tightness.
Gotcha.
There's tightness somewhere. Yeah.
Gotcha.
Yeah.
Now, does it look differently for men and women? You know, I think a lot of when we talk about pelvic pain, we think about women first, and that's just taboo in society. It's all kinds of different things, but men also get pelvic pain as well. So, does it
Yeah.
look differently for men and women? Are there similarities? Talk a little bit about that if you
Yeah.
can.
Okay. So that's a good question. So, um, traditionally, and if we treat more than pelvic pain, but if we're on the topic of pelvic pain, traditionally we see more women with the tightness aspect because, and this is just, it's not everybody, so I don't want to stereotype, but women tend to hold stuff in. Okay, we hold it in. I'm going to say it because I'm a woman, right? So we hold stuff in because we got to keep it together. We got to keep it together. In today's society, we're juggling, you know, the house, maybe kids, maybe a home, maybe a relationship. We tend to hold. And so there's a lot, and not only that, but we're vocal. So you can have something going on, but then you have to talk to somebody to get anywhere, to get care, right? So I'm going to more easily talk to a provider or a friend or reach out and seek care. So that's a major difference, right? So that's two reasons why we're probably seeing more women, because it's probably happening more, you know, with women, but also women tend to reach out more, you know. So, I mean, at my first hospital I worked at in Brooklyn, we actually had a day called Take Your Man to the Hospital Day. Yeah, because men were seeking care, right? So that's just an example of women are the drivers for medical care in their family, you know? Yeah. So now with men, these poor guys are coming to us. Where pelvic health in men is probably 1 to 2 decades behind where women are. And that's not typically the case, you know, because typically research, you know, they always say research historically has started with men, you know, the subjects are men, the people performing the research is men, you know, and so there used to be this bias of, well, is that research applicable to women? But the difference here with pelvic health between women and men is that women have gynecologists. Women have a doctor, a regular doctor that they are expected to go to on a regular basis, premenopausally every year. Right. You know, postmenopausally it changes a little bit, but where men don't have that. So our guys are getting lost, you know? And so I would say 10 to 15 years ago, it was still an average of 10 providers for women before they found help, bouncing here, bouncing there, trying to find the accurate diagnosis. Now it's better, and it depends on the location of where you are, obviously. Right. But it's probably 3 to 4 providers. It's come down, you know. Men are still where women were 10 to 15 years ago. It's taking a lot of providers. I just got a guy actually the other day. He saw 14 urologists. Wow. 14 urologists. Wow. Multiple providers, you know, and listen, I don't know everything, but I saw this guy and I was like, it's probably your hip labral tear that's causing your pelvic floor dysfunction, you know? And so, it's tough. It's tough for these guys. Yeah. So hopefully we see in the next few years that that ratio comes down, that number of providers comes down for our guys. Gotcha. You know, they're often having to find us themselves. Yeah. Versus women who are we'll talk to each other. Hey, right. You know, this is what I'm seeing. Who are you seeing? You know, so right. Absolutely. You know, guys aren't doing that. You know, no, guys aren't doing that. And it's funny because I always look around the clinic, you know, throughout my day, and I'm like, you know what? There's so many more women here than men, and always. I mean, there are probably maybe an hour throughout a day on a regular random week where we may have more men than women, or at least like even numbers. But for the most part, just in therapy at all, there's always more women in our therapy settings, at least in my office, that I've seen, than men. And I do think that women are a little more proactive when it comes to their health, a little more proactive when it comes to taking initiative for their health care and health benefits. I've had a number of conversations, like you saying, of wives being like, talk to my husband, please.
can you please talk to him? Because he can't get up, his knee hurts, he has to come see you, but he won't come
Exactly.
see you. So can you talk to him? I'm like,
Exactly.
what do you mean can I talk to him? That's crazy.
Exactly.
But yeah, there's definitely a stigma behind that. And again, when you talk about pelvic pain, I mean, that's a whole nother realm of a personal experience that not just does the person have pain, but now it's pain in an area that, can be somewhat sensitive for somebody to share. So I think it's even a little more taboo for men to say, you know what, let me go get this checked out.
Yeah.
So that could be a
Yeah.
challenge for sure. I see that.
Yeah.
Yeah, I definitely see that. So you provided hope for a number of people when it comes to reducing pelvic pain and hope through PT. You already said you saw people who saw a variety of clinicians and medical professionals before they came to see you. Is there hope for pelvic pain, and how can PT help in terms of exercises and education?
Yeah. What's really cool is seeing the evolution of this niche over the last 2 decades. It's really, really cool. I would say, the American Physical Therapy Association, we have different sections, and there's the Academy of Pelvic Health, which used to be called the Section on Women's Health. So there's all these specialties, and so probably when I got into this in like 2003, there's probably only like 1,000 people that belong to the section in the country. So you can do the math, you divide that between 50 states.
Yeah, exactly.
Not so many people per state, right?
Right.
I mean, it's increased significantly, but the idea is this, people used to have to travel to a different state. I have colleagues that were in Nevada and like Las Vegas, and people from like Arizona were flying in, and they would have to do these week-long retreats for PT. They would have to get a hotel, stay there for a week to 2 weeks, do this kind of boot camp PT, fly back home, because there were no providers in the entire state of Arizona. Do you know what I'm saying?
Wow.
It's not perfect yet, but it's way, way better, because most hospital systems now and most large health organizations have even a rudimentary program.
Mm-hmm.
You know what I'm saying? So it's going from no care to now there's some accessibility, and now I mean, in our state, and really should be in some form in all the states, there is direct access now. So
Right.
we often function as they often haven't even seen a doctor. They're really coming, a physician, they're coming to us and saying, I heard about this thing. Can I come and see you? And we're often having to send out, what you also should see this, your general practitioner or this urologist, or, we're often having to work in tandem, but we're seeing this great explosion of therapy. So when people come in, people are like a little scared sometimes, do I have to take my clothes off? Like, what?
Right.
I'm not ready for this, but, we really take things step by step, and it's not different than going to see your traditional physical therapist, because we still have to look at your posture. We still have to look at your joints. We still have to look at your range of motion. But we might look at your belly. Maybe we'll look at your belly. We have to do an abdominal screen. We have to see what's going on. We may or may not have to do a pelvic exam. If people don't want one, we don't do one. You're in control, but we can actually, we're not guessing, we're going to feel, because we are the expert in feeling and touching. That is what we do.
Yeah.
We have the license to touch. So we can actually feel, where sometimes our patients will go into their GYN, and I love my GYN colleagues, but sometimes they're just so busy. They're so busy. And you know what? They know they're going to send the patient to us. So they're not actually evaluating pelvic tension and laxity and strength. We're going to give you a physical therapy diagnosis if you have one, right? So you'll finally be able to come to a place and say, oh, so that's what you think, and I'll tell you, I think it is 75% of the problem. So we'll tell people straight up, so we will still work on flexibility and strength and tension. And we will work with you in balancing your muscles and just help triaging your case, so, and work with a team.
Yeah, that's great. That's
Yep.
great. I've seen a number of referrals for pelvic floor pain, or people calling and saying, hey, you guys have a pelvic floor specialist at your location, or I have pelvic pain. Can I come see you? And I think a number of clinicians, especially newer clinicians, and maybe even some who are seasoned, their initial response is always, I'm not sure, or let's refer them out, or let's see how it goes. And I'm curious because I know when I was in school, we went to school at different times, but pelvic floor pain was not really the focus of any of the class that we talked about. We talked about SI joint pain and back pain and other related things, but pelvic floor was not really a focus for us in terms of how to diagnose it, how to treat it, how to talk about it. And I think a lot of clinicians nowadays may have had that in their curriculums, but I know some more older or more seasoned clinicians did not. So, what are your thoughts? So what's your advice, I think, for, clinicians who may be seeing patients who do experience pelvic floor pain, even though we have our skill set for looking at musculoskeletal issues and assessing people's range of motion and strength. But when it comes to pelvic floor pathologies, they may feel like they don't have enough information or enough tools in their tool shed to deal with the situation as effectively as someone like you or a specialist may. What are your thoughts on, or any advice you want to share with PTs who are trying to make sure they can assess pelvic floor pain for their patients better?
Yeah. So this is a bridge that I would love to continue to build, yes, with physical therapists and continue with other providers too, because I don't think that every single patient, possible patient, needs to come to us, to a pelvic PT, because there's so many things that you can do, because it could be driven by the SI joint or it could be driven by the hip joint.
Right.
And you can treat those things with the pelvis in mind, with the pelvic floor in mind, like we just, one of our therapists just spoke to, the pelvic PTs, even in our company, right? I did something for the athletic trainers, and then we've even done something. We've invited personal trainers to come to, and we did a whole thing with them. So we're all about bridging that gap. When I talk to clinicians that don't, quote unquote, do pelvic health, I tell them how people with back pain that come in for back pain, 75% of them are leaking urine. They just don't talk about it, right? Why are they going to talk to you about that?
Right.
Unless you screen for it, So sometimes the leakage is dissolved when you treat their back pain. Sometimes. So right there, you're already in it. So you're treating back pain 75% of the time, you're already in it. You may not realize it, So I usually advocate for PTs to ask screening questions, if they feel comfortable with it. We're PTs, so we're seeing people all the time, right? They're coming in regularly, so you develop this rapport with them. So usually the bladder and the bowel are the big red flags for could be a pelvic floor issue, And so I just wanted to, just so we're on the same page here. So here's the pelvis here. And so if we're talking about the back, so the back's right here, right? This is the spine. So this red here, that's all the musculature. That's all the musculature. So we can't ignore it.
Right. Yeah, exactly.
Meaning it's attached, right? So for people to see, it's attached, right? So what my hips do here on the sides, or my abs that come down here in the front, it's all 1000% connected, So I'll ask people and I'll say, are you having, I'll ask them straight out, are you having any leakage issues, urinary leakage issues, right? Are you having any urinary frequency meaning going all the time, issues, do you feel like you're not able to empty all the way? Could these mean other things? Of course they could, but these are just screening questions, If they check off one of those boxes, I'm either not emptying all the way, or I'm going pretty frequently, or I'm leaking, and now I'll screen for the bowel, do you feel like you're having to strain? Do you feel like you're not emptying completely? So now you've got to check off in the bladder box, and now you've got to check off in the bowel box. And by the way, also, it hurts when I sit. I got 3. I mean, those are all topics that, I mean, I could screen for, you know what I
Right.
mean, pretty easily, especially once you have rapport with a patient, you
Yeah.
know. I mean, I honestly think if someone comes in with back pain, that should just be at the end of your questionnaire,
Right.
really, you know.
Yeah.
So those are super easy
Okay.
screening questions, that gives you a hint to say, she's also, or he's also having some tightening in the pelvis. So maybe I'm going to give this person some stretches, make sure that they're having some opening in that area. Maybe I should make sure that we're not doing all tightening in that area. You know, maybe I should focus on breath work a little bit more, you know. So that just gives you a little bit of clues to say, hey, let me just think a little further down,
Yeah.
you know. So
So
yeah.
those are good tips. I know it's funny. I think about I think a number of PTs when they think about B&B issues or bowel and bladder issues, they think automatically red flags, as in like something that's bad, like
Oh yeah,
cancerous or other things,
yeah,
right? So their
yeah,
initial response isn't so much, oh, maybe it's pelvic floor. It's maybe it's, oh, maybe it's something that's really on the far left side, like cancer, or something that's, you know, bigger than or more
right,
intense than a pelvic floor issue. Right? So I think some
right,
people get worried when you talk about B&B issues, but in actuality, it can be a simple, like you said, like a pelvic floor issue or a back pain issue or something that's related to the actual musculoskeletal structure of
right,
the pelvis, as opposed to a bigger issue that's outside of
right,
our practice.
right,
So
right.
it's good to ask the right questions, you're saying, because that can
That's
just
right.
be something that can just give you the red or the light bulb to say, you know what? I know what this is. Let's deal with this. Or to say, you
Exactly.
know what? This is not what I think it is. Let's refer out.
Right,
Yeah.
right, right.
Yeah.
Yeah.
So that's a big thing. And then, you know, I think a lot of people that I've spoken to that have been instructed to go to see someone who is a specialist get weary of how invasive it may be. Um, and I don't know what the stigma is for this, but some people, men and women, who I've spoken to say, you know what, I'm not ready to go yet. They're gonna have to go in there and touch me in different places. I'm not prepared for that. I don't want to go. I think about it. I'll see what's going on. Can you just give some advice to those who may have, I guess, the fear of addressing the pelvic floor issue that they may have? Because I think sometimes people get afraid that it's going to be, you know, the same kind of anxiety that people may get when they go see someone for a prostate exam. I think that same
Yeah.
anxiety may build up for men and for women when you talk about pelvic floor issues. So, you know,
Yeah.
what are your
Yeah.
thoughts? What are your advice can you share with those who are listening about that?
Yeah. So first of all, I want to say that I think that's pretty normal to like not be excited about it, right? So like it's an exam that's not a normal exam, right? Not your typical go to my GP, you know, kind of
Right.
exam. So, but I do want to say, you know, during COVID, we had to pivot, and I treated virtually a lot,
Mm,
like a lot.
wow.
And you would think, how does this person treating pelvic health virtually? How is she
Right.
doing it?
Right.
But we created a program and we created a system, and we just created a way to do it. And so I'm saying I was able to do it virtually. So
Gotcha.
um, nothing has to be done in a certain way. We can gather information. I can gather information through verbal report. I can gather
Mhm.
information through external palpation, which means I can touch you even over your clothes,
Mhm. Mhm.
right? I can ask people to check themselves with their own hands. I can
Right.
ask people to check themselves when they go home, right? Obviously, the more that I can do, or the more the therapist can do, the better it is, the more information that we have.
Right.
But I would never say to somebody that the pelvic exam is 100% absolutely necessary, because there's so many other clues, like I said, with other joints, other techniques that we have that we can gather information, you know. So I would not want that to be the reason why someone doesn't get help,
Gotcha.
you know. So you know, and we treat children, so we're not invasive with children,
Mm.
you know, and they get better.
Mhm.
So, so, so we have ways.
Gotcha.
But ultimately, like any type of healthcare, it has to be a dialogue, right?
Yeah.
It has to be a dialogue. So if you don't feel you can have that dialogue, you know, then we have to develop that communication. You have to be able to tell us what is okay with you, and for us to be able to listen to what you need, just like seeing yourself or any other provider, you know. So hopefully that's the feeling that practice gives off whoever people go to see. You know, we want to be able to say, hey, come in, what do you need, what do you want, what are you comfortable with, let's do it. You know, so that's not a barrier to us at all.
That's very reassuring, I think, for people who are listening out there. Thank you for sharing that. So
Yeah.
Michelle, listen, I'm impressed by all you've done, your YouTube page that has so many subscribers, and you've been sharing the community for a number of years, classes you've been giving your community, all about public health and education. And I'm curious, are there tips you can share with listeners and people who are watching now on YouTube about ways they can foster a healthy pelvis? Like, what can people do exercise-wise? There are 1,000 things people see online and 1,000 that they might find on Instagram and whatever else about what they can do. But I know there are certain things that people can do to make things feel a little better, at least in the interim before they see you or somebody else, or even if they're trying to figure out if there's an issue at all. You know, what are things people can do to make sure that they can work on exercises and things to do on a regular basis to have a healthier pelvis in general?
Yeah. So this could go so many ways, Sean. Okay. So I'm going to say just a quick word about breathing, because we do a very extensive thing about breathing, you know. So I would say if you're having any kind of pelvic symptoms, so that could be a pelvic laxity, which is falling out, feeling leakage, pelvic pain, a number of things. I'm going to talk about breathing in the way that we teach breathing. So we teach what we call rib cage breathing, which is people might hear belly breathing, you know, commercially, or diaphragmatic breathing. And those are all, there's no one right or wrong way, you know, to breathe. But I want to say, if you find yourself breathing from your neck area, these guys, we don't like it. Okay. So not everybody knows that our diaphragm, which is here at the base of the rib cage, you know, and our pelvic muscles, they move in sync with each other, right? They essentially do the same thing. So if our diaphragm and our rib muscles and our neck is all up in our throat, so is our pelvic floor. I can pretty much guarantee it, you know? So we want to think about your rib cage as being a circle, and think about wide and then soft. So think about it being more circumferential, and you can put your hands on your rib cage if that helps, you know. So not a lot of people can feel this expansion when they breathe in their ribs. Everyone's hands are on their belly, everyone. And I'm not saying it's wrong, but if you have a pelvic symptom, then I'm going to have a conversation with you about it, right? I've got to get more expansion into here in my ribs, and exhale. And it's best practice lying down, either on your stomach or on your back. Okay. And then slow it down. Everyone's breathing like they're on their way somewhere to catch a train, right? And okay, we're in the Northeast, so, you know, so everything's fast, 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 right? But I can't tell you how many people, when I'll count with them, I'll say, all right, we're going to count 2, 3. And as we exhale, you got to give me 8. You got to give me 8. If you're not at 8, we got work to do. And 8's the low end, right? So these are, and I'm not saying strain to 8. I'm saying you just want to see where you are, right? So that's my breathing in a nutshell. Where am I breathing from? Can I expand in my rib cage at all? Back, sides, anywhere, like a circle, right? And then can I slow it down? All right. I encourage people to do breathing practice twice a day, you know, just to sort of recenter themselves. Your breath work is the center of everything, right? So we want to make sure that before we start heavy exercise, this person knows how to breathe and they have control over it. Okay. Other quick tips, because we talk a lot about bladder, bowel, intercourse, all that kind of stuff. Easy things to screen yourself for are, number one, am I hovering a lot over the toilet? So this is a lot for females, right? We do a lot of hovering. And hovering means that I am suspended over the toilet, whether that be in a public restroom or work, whatever that's not your home. And so when we are hovering, our muscles are all still on, yet we are trying to do a relaxed thing, right? So then we have a ton of people that are coming back with UTIs, right? Because they are incompletely emptying by hovering. So many people know this, but many people do not. So I'm going to say, bring your Clorox wipes, get the toilet paper, the toilet cover dispenser, get that sheet of paper down, sit on the toilet, and all will be well. I promise you won't get strange diseases if you prep yourself first, So that's one thing. Number two, if you are finding yourself going into the bathroom under a 2-hour interval on a regular basis, okay? If you drank coffee or it was a hot day and you drank a whole 24 ounces of Snapple or something, I mean, you're probably going to have to go to the bathroom soon. But if you find yourself going to the bathroom sooner than 2 hours on a regular basis, it's not really so normal. Okay. These are, again, it's not like, oh, okay, well, what should I do? No, it's just, these are screening tools to say, okay, let me see why I'm doing that. Could I change that at all? Am I drinking too fast, too much? Is it just a lot of caffeine, which is an irritant? You know what I'm saying? So, I mean, these could all be possibilities. When I'm going to the bathroom, again, that number 8 comes back. I want to be able to count to 8. Okay. Because if I'm peeing and I get to 5 every time, either I'm not completely emptying, I'm dehydrated. I mean, the list could go on and on, different things. Okay. So how often am I going? How long am I going? And if we are under 65, please don't tell me you're getting up at night to go to the bathroom. Okay. It's not considered a normal thing before 65, unless you're having to take some medication immediately before bed with water, right? So then I will accept one time at night. So that's a tidbit. Again, I could go on and on, but those are little things that you could look at about your bladder. And for your bowel, I'll tell people, stop the straining, everybody. Everyone's getting all these hemorrhoids and bleeding and all this stuff is happening back there, because what's supposed to happen when we urinate is also what's supposed to happen when we have a bowel movement, meaning I'm just supposed to sit there and breathe and feel complete, right? But maybe our mamas didn't teach us. I don't know. But we've got to teach the next generation that it's not okay to strain. It's not all this heavy pushing and straining. Like, it's, what's happening. That's a flag. That's a flag. Okay. And on Shark Tank, Squatty Potty made it big. We always feel like we should have invented that, but because we were talking about step stools for a long time.
Yeah.
Put your feet up on a step stool, right? Just a few inches. That's why everyone wants to lift their heels up when they go to the bathroom, because you are improving your anorectal angle. So it opens up your pelvic muscles, and that's why squatting feels good. So everyone get your shoebox, or I don't know, one has phone books anymore. I'm into myself. No, put your feet up on a step stool. So the story that we learned in class was that the toilets in America were originally created to mimic the King of England's throne. So they were actually raised higher, which is constipating, essentially. Literally constipating. So these are just some things to look at and say, all right, if we don't know what's normal, then we don't know how to spot abnormal, right? So then that's why it takes longer to get to my provider. Oh, it's not normal to strain. I've been doing this for 20 years.
Right.
It's what we'll get.
Right.
And now my bladder is falling out.
Yeah.
To do.
Yeah.
But it's because they didn't know that was something to look for, that they didn't know it was something that, hey, that's something I should probably get that checked out. So unfortunately, some of the things that we treat are not painful. They're not pain, and pain we know is our defense system. So it doesn't signal us to go do something about it.
Right.
So we go on with about our business, and we continue the habit, and then we end up with an issue. And then eventually maybe we do have pain or prolapse or leakage or something,
Right.
so yeah, so hopefully, these are just, it's the tip of the iceberg, but I hope that, people can hear these things and say, oh, I never thought about that,
Yeah.
and then talk to somebody else about it, and then talk to somebody else about it. That's how pelvic health has spread, right?
Yeah.
We talk to each other, whether it's on social or whether it's, to our families and our friends and our children and our parents, so that's, we want this topic to also be infectious as well,
Yeah.
because it's something that all of us can be better, right? All of us can be better, right? So it's just a matter of, does it need to be addressed, or should it be addressed now? Could it make working better? Could it make me a better mother, a better parent? You know what I'm saying? If I didn't have to run to the bathroom every hour. Do you know what I'm saying? So the part of a job that we love is just like any kind of PT that we do, is to be able to help people get back to that, like motherhood or fatherhood, or just, oh my gosh, I couldn't work because I am leaking on myself all day. I couldn't be a hairdresser who was standing for 4 hours a day. She couldn't leave her clients, so yeah, so we love that. We love being able to see the moms bringing their kids and be a parent again. So we love
Yeah.
that.
Yeah, that's big.
Yeah.
Michelle, last question about PT stuff. Kegels. Everyone talks about Kegels, right? Everyone talks about, oh, pelvic floor, just do some Kegels. I think everyone, that's been like the main exercise that for most people, they just say, well, I'm going to do my Kegels and that's going to help. But I know it's so much more than that. We know it's so much more than that. So
Yeah.
are there exercises that you can maybe share quickly with the listeners just to say it's Kegels and as opposed to,
Yeah.
Kegels, just do your Kegels and keep going with the rest of your life.
Yeah. So first of all, I think Kegels were a big thing. First of all, Kegel is the name of a dude. Okay. So that's why Dr. Arnold Kegel. So that's why when people say, do you mean a Kegel? And I don't use the word Kegel a lot because it's, people don't know what that means.
Right.
What does that actually mean? I'm not talking about a muscle, and I'm not talking, it's not actually a verb. It's not a real,
Right.
like, right. I'm not, so it's sort of this amorphous, like, what am I contracting? What am I tightening? So we're really talking about those pelvic muscles, these guys, right? So when people say Kegel, they mean take this bowl and do this, right? Pull it together and lift it up. That's essentially what the word Kegel means, to lift up this bowl, take it, squeeze it, and lift it, pull it up inside. We are finding, yes, there is definitely a lot of laxity, but a lot of people are too Kegeled. They're too Kegeled. So then people come in, maybe they see a provider that is not a pelvic health provider, or sees somebody else, a trainer, someone well-intentioned, you know what I'm saying? You probably need to do more Kegels. If you do not do a screening, exam, abdominal palpation, anything, if there's no actual, even general examination, you have no idea if they actually need reverse Kegels. Okay. So then we are telling these people that are too Kegeled up to do it even more. And they're going home disappointed because they are unsuccessful.
Right.
I'm still in pain. Oh, actually, I'm in more pain. One of the conditions that we treat, called interstitial cystitis, which is a bladder inflammatory condition, it's actually contraindicated to do Kegels. So if people are not familiar with the condition, or they're just talking about, I've got pain in my pelvis, and tell them to do Kegels, they're actually doing them a disservice. Right. So some people are way too tight. It's like someone coming in with their upper traps and saying, you know what, you probably need to do some shoulder shrugs. Right, exactly. But wait, your upper traps are actually on fire. So maybe that's not a good idea to do. Right. So, but because it's down there, we're sort of like, hey, just go with it. Come back and tell me what you think. You know what I'm saying? Just go with it and see, So those people people that are too tight, that are too lifted, actually need to come down. They actually need to come down and open. So we'll use that elevator example where, we all kind of live on the first floor of the house. And then we go up to the second floor in terms of tightening, where, I need to exercise now, or I need to pick up a heavy box. I need to raise my voice and sing. All of those activities require greater recruitment of the pelvic floor, a little more tightening, a little more something, right? So I can go up to the second floor, and you know what? If I'm in a state of like panic or danger or anxiety, I'm probably up at the attic, right? I'm all the way up here. The other normal function that we should be able to do is get to the basement. We all should be able to do that same normal function. If I go to lie down, if I go for, let's say I go for massage, and I just want to let my body melt into the table, I can just kind of feel, I can kind of feel like these sit bones, they kind of spread apart. I'm just kind of letting go. So you can envision your pelvic floor muscles, this bowl kind of sink away from you, right? Or the door is kind of like, it's just coming away from you, opening, but not because I'm straining or pushing it, but because I have allowed it.
Yeah.
So it's sort of a mindful piece of it, where, and I'm not saying this is all mindfulness. I'm saying there's a part of it that has a mindful component, So I'm saying for these people, it's to their benefit to practice that rib cage breathing, where they slow themselves down and allow their muscles to finally let go, because you're giving yourself permission to say that it's okay to do that, and I'll tell people, what, after you urinate or have a bowel movement and you're still sitting on the toilet, maybe that's a good time for you to actually fully let go, because it's safe. If you've got more urine or stool, you're on the toilet. So everybody's safe here, Just spend a minute and breathe and feel what that feels like. Know that it's okay. Know that you're in a safe place. And some people will say, you know what? More urine came out and I actually feel done now. So, because again, we're getting up before we're done,
Right.
So I'll have some of my guys do that. I'll have some of my guys sit down, and say, you know what? I know standing is good, but you know what? Let's see what happens when we sit, So, that's what I would say, is that sometimes it's a Kegel, but sometimes it's reverse.
Gotcha. No, that's big. That's big. I appreciate you sharing that with me.
It's very big. And, when I started doing therapy, we had no internet, so we had something called listservs, where we had multiple people on a mass chain of emails, right? And that's how we shared information, and textbooks.
Yeah.
So it took me a long time to do what our staff does in 2 weeks. You know what I'm saying? In terms of learning.
Right.
So, but this is an important concept that is not always out there in social and in commercial, marketing. Everything is about lifting, all these machines, all these electrical devices. But there's also about lowering ourselves, our mind, our nervous system, and that includes our pelvic floor.
Yeah.
There's an old study actually where they hooked up electrodes to people on the outside, and they showed them movies. And when they got in the horror movie, when they got to the scary scenes, they were testing, an EMG, surface EMG, and they could see how on the scary parts, the jump scares, boom, boom, boom. So we know that we could be holding on. Depending on what went on our day.
Yeah,
Do you know what I'm saying?
Absolutely.
So it's so tied to here.
Yeah. Yeah, that's huge.
Yeah.
Michelle, I thank you so much for being on this show. Listen, any final tips you want to share with listeners who, again, are in pelvic health programs now, or thinking about going into, or seeing a specialist or a PT about pelvic health pain, or are just trying to go out there and just be healthier in general? Any final tips you want to share for this PT month?
Yeah. So I want to say that there's help out there, right? So and if there's not a pelvic health PT around you, there's so much virtual care, or we can direct people to a provider that is knowledgeable in pelvic health, and it's all about people are trying to look for the person that's going to get them all the way better. But sometimes it's just about, can I take the next step to get me 5% better, 10% better, 25% better? You know what I'm saying? What steps can I take? Because then I can go on to the next step, but just take it a day at a time, a month at a time, because sometimes that's all your body can handle.
Yeah.
You know what I'm saying? But there's help out there. And especially for PT month, pelvic PTs are really, we're really, really proactive in helping to get that team together. If you need other providers, other specialists, we're usually in we're usually in touch with a lot of great people. And so we love being part of that team, whether it's physicians or trainers or massage therapists or chiropractors or just that team that works together to help you to get better. So I would encourage people to reach out because it's not scary. We're here to help. So.
Awesome.
Yeah.
Michelle, this Be More Today platform has been going on for a couple of years now. I ask everybody on the show when they hear the phrase Be More Today, what it means to them. What's that phrase mean to you?
Yeah. So kind of spinning off of what we're talking about, I would say being more is exactly that. Not having to strive for perfect, but just being more, 5% more, right? 1% more, right? So it doesn't, we're all caught up in like, I'm not at 100% yet, right? But if you look back a month ago, you're actually 25% better. Do you know what I'm saying? So it's all about being more and being better than yesterday, right? So that's really what we try to instill with our patients, because some of these conditions that we treat are really long-standing conditions, and sometimes people do feel like there's no hope, and it's not as easy as an ankle sprain where, in 6 weeks you'll be back. You won't be probably for 6 months.
Right.
You know what I'm saying? And I'll tell people that straight out, and there's a lot of initial disappointment, and I'm like, oh my goodness, you've been in pain for 2 years. If you get 25% better, in the next month, that's a win.
Yeah.
You know what I'm saying?
Absolutely.
So being more, I think, is exactly being better than how we were yesterday, last week, last month, in terms of less pain or less stress, or just being free from whatever vices that we're holding on to, so that's what I think.
Absolutely. Michelle, where can people follow you on Instagram, Facebook, or otherwise?
Yeah. So right now we're in transition right now, but we actually have some blog posts up on our own website on jagpt.com. So you just have to look at our pelvic health section for blogs, and you'll find some great stuff from our clinicians. So hopefully either you could share it, or it's just jagpt.com. And please look at the pelvic health session on our blogs, because we have some great things there.
Awesome. Michelle, thank you so much. You've made episode 1 for the books. A great episode of public health. I appreciate you so much, and I hope to see you sometime soon.
Thank you. Thanks, Sean.
No problem. Folks, you said so many things, so many nuggets about public health, and please go on the website, JagPT, check out what's going on, check out our YouTube page as well, and get all the information you need to make sure you can live the best life you can, to be better and to get back to life you love. The quote from today, again, when you have exhausted all possibilities, remember this, you haven't. And Michelle told you that from the get-go. There is hope. Percentages do matter, and any kind of progress is progress, especially for PT health, public health, and all other things related. So go out there, find a person who's right for you, and never give up on being better during this month of celebrating PTs. As I always say, folks, have a good day, have a good night, have a great life, and continue to take your steps to greatness to be the best version of you. We'll see you next week. Peace.